So here we are now talking about management of obesity treatment options. Before we start this slide, I think the most important things to understand is prevention. Why we are waiting until this patient having like comorbidities, diabetes, hypertension, coronary vascular disease, cardiovascular disease. We should act before controlling patient weight, and this will help us to prevent the comorbidities. According to some guideline, they said modalities for our recommendation, modalities for management of obesity, including reduced calorie diet. So try to help the patient to tell them that you should try to control your calorie intake by controlling your diet. Some studies, they said if you control the calorie intake 1,000 to 1,400, this will help you to reduce the weight. But selection of these modalities to a patient not moving, not walking, or he's walking in wheelchair, it's not good for sure, because his weight is actually maybe 300 or something kg. So it will not help him. Increase activity, yes, we can ask patients to increase their activity. This will help them to lose some calories, but again, we should select this modality for someone need these modalities, not for someone with high weight or high body mass index. Behavior modification, yes, for any intervention or any treatment, we should ask the patient to change their lifestyle. We should ask them using different strategies like self-monitoring of eating habits and physical activities. The other things is pharmacotherapy. And many questions coming to us, to the clinic, asking doctors, just give me medication, try to give me something to help me to decrease weight. Don't do surgery for me, I can't do exercise, I can't stop my eating, I need just medication to help me. But till now, there is no real studies showing that there is an effective treatment, medication, helping to decrease weight. We'll talk later about some recommendations, but again, till now there is no medication approved by FDA to reduce weight. Surgery is another option, and consider for patients with class 3 obesity when their body mass index is more than 40, or if their body mass index more than 35 with comorbidities. Now there is some studies saying that, let's say, okay, patient is coming with body mass index of 30, but she tried to be pregnant for more than 15 years, and unfortunately she failed. She started to have back pain, she started to have osteoarthritis. What we should do for her? Should we leave her and don't do any intervention, just ask her to control her diet and do some behavior strategies or modifications? Or we should interfere as a surgical intervention and help her to get pregnant. Some studies now, they are working on that, and their recommendation is not published yet, but their recommendation is to go ahead with a surgical intervention for this type of patients. So that's what I meant by medication. We have different type of medication, which include dexphenfluramine. Again, there is side effects. It could give heart problems. Other medication is same category of the previous medication. We call it phenfluramine. It's a serotonin releasing agent, and it could give you heart problems. Another medication like Xenical, which is inhibit pancreatic lipase and decrease fat absorption. There is some side effect from that medication: soft stools, diarrhea, anal leakage, and also it's decreasing the absorption of fat soluble vitamins. Action treatment. This is really important slide, because what we should do as a government, as a physicians, as a patient, as a population here in our kingdom. First of all, I think we should support more researches into weight regulation and the causes of obesity and the outcomes of obesity treatment. The second thing, we should know that the causes of obesity are complex and that both genetics and behavior are part of the emergency pictures. Also, we should encourage individuals to a small step toward increasing physical activity by teaching them or helping them in the schools for kids. So we give them some lectures regarding the importance of the physical activities by changing our lifestyle here in Saudi Arabia. Also, it's really important to encourage the state and local authorization to provide more opportunities for safe community-based physical activity programs. We have no programs here in Saudi Arabia. Even the school, there is no clear programs. Boy school, girls schools, we have no programs for physical activities. Eliminate complex problems by healthcare providers and individuals about obesity. We should make it easy for the patient, or what we call it, patients should have an access to the health system. Unfortunately, when we do surgeries now, the waiting list around 3 to 4 years. So sometimes we call patient while already he died from comorbidities, unfortunately, because we have a long waiting list. So action statement, one of the action statement is make the treatment obesity shared responsibility between the health providers and the individuals. Emphasize that whole person. So we are not treating just the diabetes, we are not treating just the hypertension, we are treating the whole person. And we remember all the time, if we prevent the obesity or if we treat obesity, there will be no diabetes, no hypertension, no coronary artery disease. Other strategy is emphasize the total picture of individuals. Okay, one of the strategies also is educate the public about importance of preventing obesity. We should teach them, give them lectures, TV programs about the importance of physical activities. The last action statement or strategy statement is develop effective education program aimed to prevent the development of obesity in childhood. We know that in Saudi Arabia is increasing the childhood problems. We should do something to prevent that disease. This is the end of my lecture. Message from me to everyone is that obesity in Saudi Arabia is increasing. We should work together, doctors, patient, public, government, everyone, we should work together, one hand to prevent this disease.